Good morning, everyone. This is Jay Mann from Amada Senior Care, here with another episode of Java with Jay. Today we're joined by Hannak Lettshek of August Healthcare.
Yes.
Welcome, Hannah. We're glad to have you again.
Thank you. Thanks for having me.
Yeah, absolutely. I met Hannah a couple months ago. Hannah's new to our industry, but brings sales experience. She is the representative for August Healthcare, which is formerly Little Sisters of the Poor. Mm-hmm. So help us understand who August is and how this came to be.
So August is a senior living community.
Okay.
We have skilled nursing, assisted living, and independent living.
Wow.
Like you said, it used to be Little Sisters.
Right.
Which, goes back to like the 70s.
Okay.
And then in 2019, the sisters left and August took over. We had our 2-year anniversary October 1st, actually.
I did not know that.
Yeah,
this is great information.
So the company itself is new and it's small. There's only 8 facilities, but...
So when you say 8 facilities, they're not just 8 facilities in Richmond. They're spread out through the region.
Yep, there's 5 in North Carolina, 3 in Virginia, and 2 of them are up in the DC area.
Okay.
So the only one in Richmond.
So I think that's interesting that you have skilled nursing, assisted, and independent in the same community. Right. So would this be considered like a CCRC, a continuous care retirement community?
So our assisted living technically is.
Okay.
It really just depends on which level the individual needs to go to, but CCRC would be our assisted living.
I see. Okay, very good. So a lot of the CCRCs have to be independent living in order to move in. That's not the case here.
So if, for example, we have the skilled nursing, maybe someone falls, breaks their hip, is in the hospital, just needs some therapy, but prior to going home, they could do our skilled nursing and then maybe discharge to the assisted living if they just need a little bit of supervision. Okay. Or they can just do completely independent where you take care of yourself. Right. You're just living in a secure community with like-minded individuals. Right. Just near nurses and whatnot. We're basically just like a friendly landlord to those. Okay. But the CCRC assisted type is you have the nurse there, you have your medicine management, you have your meals cooked for you, things like that. Okay. And then your your skilled is the very hands-on complex nursing needs, 24-hour care. Can
someone from outside your community go to the skilled nursing, or is that only for your residents?
Yeah, no, anybody who's looking for skilled nursing.
This is good information. I was not aware, and I think I live about 10 minutes from you, and I didn't know these things. So this is a great service. Clearly, you're differentiating yourself by having a skilled nursing facility on your campus with independent and with assisted living. Is there memory care as well?
So we don't have memory care as of now, but we have like I think it's a $10 million renovation.
Oh my goodness.
Since we are a newer company. Sure. And like I said, we were built in the 70s.
Right, so you're updating the community.
That's in the works. All right. So that is a big plan that we're doing is going to be memory care. Hopefully in the next year or so, all that starts.
That's amazing.
Not quite.
Well, and you're doing quite well already. Even before the renovations, you were saying that you're full at this point.
Thank you.
But more people are lining up and getting on your waiting list.
Exactly.
Will there be an expansion once the renovation happens?
Yeah. So right now we're a very small, community-focused facility. We only have 32 skilled beds. Okay. We're going to like 120.
Oh my goodness.
So it's really going to go up, but it's all the same, so much of the same staff that worked with the sisters. Our activities director's been there 47 years. Okay. So it is, although we are growing, it's still the same staff, still very hands-on. Our slogan's distinguished care. So it's very personalized, very catered to the individual.
When I talk with you about this community, I see a smile on your face. Tell me what you love about working there.
August is cool since it is smaller. Okay. I mean, I've had dinner with our CEO. Okay. If you ever have an issue, give me a call. We're here to take care of people. Okay. And I can't do that if I'm not taken care of. So everyone is just so kind. Everyone wants to be there. Everybody realizes the part they play. Okay. I've even had a patient who wanted to come in, but we didn't have her type of food. Okay. So I called our CEO and he goes, order on Amazon, overnight it. She wants to be there, get her there, which I've never worked for a company that's that immediate type stuff.
That's great. Well, I think it's a wonderful contribution to the community, especially in that area in the West End. I mean, there's Richmond has different pockets, right? So you have your northeast, you're south of the river, you're north of the river, and Little Sisters of the Poor had been there for a long time, but to be able to take this, and it sounds like you're taking it to another level, I think that's going to be a wonderful contribution to the community. So, Hannah, thank you so much for coming in today.
Thank you.
I appreciate seeing you and wish you all the best luck.
Thank you.
All right. Jay Mann from Amada Senior Care signing off on another episode of Java with Jay.